Hey everybody, welcome back to Pick Dr. Osborne's Brain. Another great Monday night for you. Tonight we're going to be talking all about inflammation. And I want you to make sure that you tune in and stay with me to the very end. I'm going to be talking about the 7 top nutrients that I recommend that you take to help support your chronic inflammation and help you overcome that. Now, in honor of September, this is actually Pain Awareness Month. That's why we're doing this show tonight. Because many of you are out there, you're suffering from what I call the itises, I-T-I-S. That's inflammation. So if you've got a disease that's caused by inflammation, arthritis, tendonitis, pancreatitis, hepatitis, right? If it ends in itis, that means its cause or its root origin is inflammation. So we're going to be talking about what those inflammation triggers are first. I want you to understand what these are, because if you understand where the inflammation is coming from, then you can mitigate the source. And if you mitigate the source, a lot of times you don't need supplements, you don't need medications to block inflammation because you've taken care of the source, the origin of where that inflammation is coming from. So that's what tonight's show is going to be all about. Now, before I dive in, I'd love you to say hello, so make sure you go ahead and type in that box. Tell me where you're from. I'd like to know where you're tuning in from and say hello to me. And also would love it if you would hashtag me for me. So save 100 million lives is the hashtag. If you'll use that for me so people can find us easier when we share the information. If you can hashtag that in the feed for me, that would be great as well. So hashtag save 100 million lives. That's what we're all about. If you're new to the Dr. Osborne Show, remember, our mission is to help the 100 million chronically sick people find real answers to their healthcare problems without drugs, surgery, and other unnecessary interventions. So, hashtag save 100 million lives. Let's dive in. Tonight, it's all about inflammation. Now, what exactly is inflammation? Inflammation is a normal process. So first and foremost, I want to talk about inflammation as a normal process, not as a disease, because when we start calling inflammation disease, it's kind of like demonizing cholesterol happened in the 1980s. We started demonizing cholesterol, and then it led to all these drugs and all this intervention and all this misinformation. Well, inflammation is much the same way. Inflammation is not bad. So inflammation is not bad or evil. Inflammation is normal. Now, when we get into problem, it's because inflammation is elevated. So when we talk about what creates or contributes to disease, it's not the normal inflammatory process, but it is elevations in inflammation. So when inflammation becomes exaggerated or it becomes chronic, and it leads to the fundamental breakdown of tissue. If we look at what inflammation actually is, inflammation is your body's wrecking ball, or it's your body's bulldozer, tearing down an old house to rebuild a new house, right? We tear down old cells so that we can replace them with new cells. And in order to do that, we use the process of inflammation internally to remove the old tissue, the old damaged tissue, to get it out of the way so that we can make new tissue to take its place. So inflammation in and of itself, we don't necessarily want to block it. We don't want to inhibit it. But chronic inflammation, we want to find the source, because again, if there's something that's creating a chronic level of inflammation, we want to know what that is so that we can mitigate it. So again, we're not blocking inflammation with medicines. And so let's actually talk about some of the inflammatory pain triggers. Now, for some of you, inflammation is triggered real simply by trauma, right? You sprain or strain a muscle, tendon, or ligament, and so you have this traumatic incident, and so that is followed up by an intense period of inflammation where your body is going in there, looking at the damage, assessing the damage, and it begins the process of recruiting white blood cells to that area to start repairing things. And that is accompanied with swelling, an increase in white blood cells, an increase in temperature around the area, so fluid accumulation into the area, because your body's pushing blood and fluids to that area to help it heal, to get rid of the damaged tissue. Acute trauma is a normal type of inflammation. If you hurt or injure yourself, we want this. We don't necessarily want to block inflammation when we have acute trauma, unless the acute trauma is so severe that we can't handle the pain. So like a fractured bone, yes, it might be helpful to block some inflammation, but if we're talking about a sprain, strain, if you can handle it without having to take heavy doses of painkillers, you want to allow the inflammation process to run its course. So trauma is one trigger for pain and inflammation, but most of you they're watching the show don't struggle from chronic trauma. Like you're not breaking your ankle or spraining your leg or tearing a biceps tendon on a daily basis. These are things that happen very infrequently to most people. So trauma is not the cause of what we're dealing with and what I want to really talk about tonight, which more specifically is the chronic inflammation. So let's talk about some of the other sources of inflammation. We're talking about sedentary behavior. Now, you're like, Dr. Osborne, what are you talking about? Sedentary behavior is a cause of inflammation? Yes, it is. When your body is not using its tissue, when your muscles and tendons and ligaments and bones are not being utilized and moved, your body will break them down faster than they're repairing. It will actually set off a sedentary inflammatory trigger where your body is breaking down faster than it has the capacity to heal. Your body is basically what it's saying when you're sedentary is, if you're not going to use that muscle, if you're not going to use that bone, then we're not going to expend a bunch of resources sending blood supply and everything else to that area. So we're going to pull back from that area, and that area is going to start to erode and degrade. This is why people that go on bed rest for things like back pain or an injury, and they stay on prolonged bed rest for too long, their muscles shrink, their tendons and ligaments shrink, they begin to atrophy, they begin to weaken. And then when you get up from a sedentary, long-term sedentary situation, of the day. Maybe you exercise on a regular basis, but what happens is you sit all day at work. This is a lack of movement, even though you might exercise regularly. So sitting for prolonged periods of time can actually contribute to, again, that same degradation that happens with sedentarianism. So lack of movement. So again, you might exercise in the morning, but if you sit at a desk for 8 to 10 hours a day, that's still a lack of movement. So you want to incorporate movement into your lifestyle. You want to incorporate consistent movement throughout the day. That means you might, take a break from your computer desk or take a break from your screen. If you're sitting in front of a screen for hours on end, take a break every 30 minutes. Get up, do 10 jumping jacks, do 5 burpees. Do some deep knee bends, do some toe touches, do something to get repetitive movement throughout your day. And here's why. Your joints themselves don't have a blood supply. They are nourished not through the blood, they're nourished through motion and through movement. So if you're not moving, then the oxygen and the nutrients that are supposed to basically bathe your cartilage and keep the health of your cartilage in alignment with its structural integrity, if you're not moving, that's not happening. Your cartilage is becoming malnourished over time, and the more malnourished your cartilage becomes, the faster it deteriorates and ages. So it's not just about, okay, I exercise in the morning, but then I go to work and I sit down all day and I have no movement at work, or I have very minimal movement at work, because this is just as detrimental in many ways as this, because it's going to create the same type of scenario. So the key is consistent movement throughout the course of your day. You want to move in the morning, you want to move in the mid-morning, you want to move again at lunch, you want to move some more after lunch, you want to move a little bit after lunch, you want to move a little bit more. So like walking upstairs, jumping jacks, push-ups, sit-ups, toe touches, whatever you've got, do it. I'd go so far as to put a treadmill underneath my desk so that if I'm sitting for a time, I can move my chair and then I can walk for a little while. Treadmill can be a very effective way to get motion and movement during the course of the day, but I also inject periodic breaks where I'll do little mini bursts of exercise, little mini bursts of high intensity exercise. So something like as maximum push-ups, as many push-ups as you can do, and then you're done, then you get back to work, right? Or you do something like jumping jacks, or you do something, again, like a burpee, or whatever that looks like for you, whatever you're capable of doing, whatever you're tolerable of doing. Because, you know, if your shoulder's injured, obviously you're not going to do burpees, but you may be able to tolerate, you know, toe touches or deep knee bends or something along those lines. But it's the consistent movement throughout the course of your day that you're shooting for. Your body does better with consistent movement, and if you want to stop inflammation from setting in based on lack of movement, that consistent movement is actually the cure. It is actually what will relieve you of that. Now, many of you say, well, I'm already stiff and it already hurts, and for me to do a lot of these things hurts. You have to break through a certain level of pain to get on the other side. So if you're already pretty sedentary, if you are overweight, and that pressure on the joint and that sedentarianism kind of combine together to create this scenario so that when you do try to do some of these tips that I'm giving you, that it creates some pain, know that you're going to have some pain first. There's going to be a breakthrough where you're going to get sore, there's going to be some discomfort, you're going to have to break through some of that, and just know that. Now, breaking through sore pain is a lot different than breaking through an injury. So if you have a true injury, you obviously don't want to start exercising that injury. But if you just have pain as a result of stiffness, you're sitting in your chair, your knees are stiff and they grind when you get up, your ankles click and pop, those types of things, those are lack of motion and lack of movement and sedentary lifestyle. So you have to break through some of those creaks and groans in your joints in order to, get to a level where it's not happening anymore, but it has to be done consistently. So very, very important if you're trying to overcome inflammation, physical inflammation in your tendons, your ligaments, your joints, etc., that not having a sedentary type of lifestyle and not having a lack of motion or movement consistently throughout the course of the day is going to make it very, very hard. Capacity at making the testosterone. So food can be a major trigger of inflammation and can create all kinds of problems. And one man's food is another man's poison. So we have, in a sense, what we'll call food sensitivity. We have food allergy. Now, these are not the same thing. We have food intolerance. Okay, and then so these are kind of the big, if we think about it from an immune perspective, sensitivity and allergy both kind of happen in the immune system where you're creating an inflammatory pain, and tolerance is a little bit different. A food intolerance is when you eat a food and you can't digest it, so it sits in your gut and it rots and it putrefies and it creates gas, and the side effects of all that creates a secondary source of inflammation. So where these are immune responses, okay, this is a lack of digestibility. You can't digest something, and so then the byproduct of that creates a secondary source of inflammation. Okay, so food can be a major trigger. Now, if you don't think you have food triggers, let's talk about some of the most common ones. It was actually one of the reasons why I wrote No Grain, No Pain, was to discuss some of the more common triggers. Now, one of the biggest food-based triggers, of course, is gluten and really, not even really just gluten. Gluten is a term many of you may identify with, but grain as a whole. And there are a lot of different reasons why grains as a food source can create pain and inflammation. Number one, grains are very, very high in gluten. So gluten as in and of itself, there's an estimated, well, we know at least 1% of the population is gluten sensitive, but it's estimated that 30% of the population is gluten sensitive. So that's a third of people that are eating gluten-based foods that may not, or probably should not be eating them, and that this is a driver of the inflammation. But we also know that grain is very high in carbohydrate, so it can create a carbohydrate toxicity that leads to hormone elevations that contribute to pain and inflammation. We know that grains can also contain pesticides, so a lot of the pesticides, also chemicals, right, that are going to contribute to inflammation. We know that some of the grains are contaminated with things like lead and arsenic, especially like rice, and these heavy metals can actually contribute to pain and inflammation. We know that grains can contain mycotoxins or mold toxins, and that these mold toxins for many people also can be a source of chronic pain. So, from a perspective of one food group, grain is the one I would recommend really truly avoiding if you want to get out of pain. Another one, though, another food group we'll come down here a little bit, is sugar. And it's not really a food group, but it's what most of you are exposed to on a day in, day out basis. You're exposed to sugar, even if you don't know you're being exposed to sugar. Look, aside from the obvious, candy and soda and things with obvious sugar, a lot of you don't realize that your cereal products, if you're using them, contain large quantities of sugar. That macaroni and cheese, if you're using it, contains sugar. That the pizza you might buy from the pizza store, it's not just tomatoes, it's actually got sugar in it. And that the tomato sauce has sugar in it. And that the salad dressing has sugar in it. And that a lot of the other additives and the other preservative foods, like if you're eating, garbage food or frozen food, like things like Hot Pockets and, microwave dinners, those things all have sugar in them. And so, it's my bad genetics, or it's something else, but there's no way it can be food. Food is one of the major triggers, and dairy is a big one for several different reasons. Number one, a lot of your dairy products contain other hormones like recombinant bovine growth hormone. Dairy contains a number of different agents. First of all, the type of fat in dairy, even if you're buying a lower fat type of dairy, the type of fat is very high in omega-6. And that type of fat is promoting of the inflammatory pathway. So when your diet is very high omega-6, very low omega-3, that can contribute to chronic pain. But dairy has other elements to it. There are a number of compounds in dairy. A lot of your processed dairy contains a chemical microbial enzyme called meat glue or microbial transglutaminase, and that has been shown to create pain and inflammation. But dairy can also mimic gluten. So for many of you with gluten issues, dairy is a gluten mimicker. Now, certainly there are other foods that can cause pain and inflammation as well. My advice to you is if you've cut out gluten, sugar, and dairy, you're still struggling with some form of pain and you don't know why, now's the time to get with a functional medicine doctor. If you've implemented this and it didn't work, get with a functional medicine doctor and get properly tested. And if you don't have a functional medicine doctor and you're looking for one, call my office. We do take distant clients, so we do online consultations as well. So if you can't find one that's good in your area that you can trust, look, don't hesitate to reach out to us at Origins Healthcare at drpierreosborne.com. But these other foods, so besides from gluten, sugar, and dairy, the other foods, you need to be properly tested to make sure you're not having food reactivity, because again, that food reactivity can be a major source of chronic inflammation for you. Some people react to nightshade, some people react to soy, some people react to other forms of legumes, some people react to lectins in different foods that create inflammation. So again, this is very, very unique to the person, and it really should be, if you're struggling, it should be analyzed to a very great degree. Now, another, let's go down to number 2 here if we're looking at other kind of sources of inflammation. So, nutritional deficiencies. Now, I said before food can be a cause of pain, meaning eating the wrong food, right? But let's talk about how not eating enough of the right food can also create pain through nutritional deficit. So, a person can not be getting adequate quantities of the right food, and they can become nutritionally deficit and start developing deficiencies. And there are a number of different nutritional deficiencies that can also contribute to pain. For example, let's say that your diet is very, very low in overall protein. Now, protein is an agent that's necessary to heal. And where I'll see this a lot is in vegetarians that take it too far, like they don't get adequate protein on their vegetarian diet, and they don't even realize it, but then they start easy bruising, they start seeing a bunch of bruising on the skin, light bumps create. Nutrients, the vitamins and minerals regulate the inflammation process. So for you to have a healthy inflammation response, and as opposed to an aggressive inflammatory response or as opposed to a chronic inflammatory response, you've got to have nutrients regulating those pathways for you. So again, the minerals, the magnesium, the zinc, the calcium, the chromium, the selenium, the copper, all very, very important. The B vitamins, vitamin D, vitamin A, vitamin E, vitamin K. Your nutrients are very, very important to regulate, again, the normal inflammation process within your body, and being deficient in certain nutrients can certainly lead to an increase in inflammation, and therefore when your inflammation outweighs your ability to heal, in other words, when your body's producing a greater level of inflammation than it is producing chemicals that help you heal and repair, then you end up in what's called a repair deficit. And so then your body and your tissues start to slowly break down and create more and more problems for you. So you need those vitamins and minerals. If you're struggling to know what those are, I always say just start with a solid, if you want to start with something that's just solid, start with a really high quality multivitamin here. If you're just trying to support your nutrition, because a good solid multivitamin is going to contain the main minerals, it's going to contain all of your B vitamins, and it's going to contain your fat-soluble vitamins as well. And so that in and of itself will give you kind of a baseline of support. A lot of people find that just being a little bit low in a particular nutrient can create a problem, and taking a multivitamin might be helpful. Now, probably not a cure-all, and if you have a severe enough deficiency of a nutrient, taking a multivitamin is not going to cover that. Now, that being said, there are other nutrients, but I'm going to get back to those here shortly. We'll come back to those and how they work here shortly. I want to go back to some of the inflammatory pain triggers. So we've got, again, food. We've got nutritional deficits being a major one. We talked about sedentary activity or lifestyle or lack of activity. We talked about lack of motion and movement. We talked about trauma. So what's next? What's after that? We've got chemicals, chemical exposures. Now, oftentimes, the chemical exposures, and I'm not talking about you work in a chemical factory and you're exposed because you've got you're working with asbestos or something like that, although that can be the case. Most people don't get chemicals because they're working, in a chemical factory. Most people get chemical exposure because of what they eat, and what they eat isn't actually food. It's what I would call, we just add a little R in here. It's food. It's frankenfood. It's not really food. They're being told it's food, but it's not food. So what is this? What are some of these? These are the food preservatives, the food additives, the processed, the packaged food. Look, none of it's really good for you. So knowing that and avoiding it, it's going to take out, remember, there are 3,000 chemicals that are in the diet that are approved for use in processed products. And so many of these chemicals are notorious for creating or increasing levels of inflammation and changing and altering your biochemistry. And some of these are some of the most common food additives. I mentioned one earlier, which is something called microbial transglutaminase, or meat glue. Now, I did a whole show on meat glue if you want to go back into the Dr. Osborne archives and check that show out. But that's just one example. You've got artificial sweeteners, you've got preservatives like sodium benzoate or benzoic acid, you've got synthetic flavoring agents, you've got even natural flavoring agents that are derived from genetically modified or genetically manipulated foods that have lots of pesticides in them. You've got your non-organic foods containing different pesticides and different in the air, like the benzene gases and the petrochemical gases and other things. So how do we control our chemical exposures? Number one, my advice is to test to see what you're reacting to, and then two, filter out what you find and be very, very meticulous about it. Because again, some chemicals are found in food, some chemicals are in the air that we breathe, some chemicals are in the water that we drink, and you definitely want to do your job trying to filter those things out to mitigate, again, that chronic inflammatory response. So again, food, nutritional deficiencies, chemicals. Let's talk about another trigger, microbial imbalance. Now, you notice I didn't say infection here, I said imbalance. A microbial imbalance, for example, a perfect example of this would be like a yeast overgrowth. A yeast overgrowth in the GI tract will lead to the production of a number of different inflammatory chemicals that can penetrate into the bloodstream and create a systemic type of inflammatory problem. For many people, that leads to liver damage, that leads to skin rashes, inflammation in the skin. It can lead to neurological pain. Yeast can steal magnesium, and they can steal B vitamins from you. So this problem here can actually create number two. So, again, number four feeds back to number two. In many ways. Now, so you can have something like a yeast overgrowth. You can also have a bacterial overgrowth. Any of you ever heard of H. pylori? Helicobacter pylori in the stomach can create physical manifestation of chest pain through gastroesophageal reflux disease, and that's just one example. So there are a number of different examples of microbial imbalances: yeast, bacteria, parasitic, fungal. They're all potential possibilities that if you're suffering or struggling with chronic inflammation and chronic pain, these things need to be ruled out, lest you're missing one of the big reasons as to why this chronic inflammation continues to persist. Now, another big reason is medications. Many of you, like if you're in chronic pain, one of the reasons you're taking medicine is to treat the pain. But did you know that medicine can actually create the pain? And so a few different examples here for you. We'll use a couple of real simple ones. One of them is non-steroidal anti-inflammatories. So medicines to actually treat pain, the ibuprofen, the aspirin, the different brand names like naproxen, etc. These are called non-steroidal anti-inflammatory drugs, medicines that are used to block inflammation and subsequently to reduce pain. Now, the problem with these medicines is if you have chronic pain, not acute pain, but chronic pain, and you stay on these medications for months and months at a time, one of the side effects of these medications is they erode your esophagus, they erode the lining in the stomach, and then they also can erode the proximal small intestine. So that would be your duodenum. And a lot of research has confirmed this, that even enterically coated, for example, a lot of doctors say, well, I'm going to give you enterically coated aspirin, so it shouldn't cause the problems. but even enteric-coated aspirin can create ulceration or can rip a hole through the GI tract lining, leading to leaky gut. Leaky gut creates chronic inflammation. So the medicine that's being used to treat the chronic inflammation ends up creating a damage to the GI tract that causes a leaky gut that feeds back and allows things into your bloodstream that don't belong, and that triggers chronic inflammation. So that's an example, just one of many examples of how medications can actually contribute to chronic pain as well. There certainly are other medications. I mean, we could talk about opiates, another class of medication that's used chronically for pain that shut down digestion. They actually shut down the GI tract. It's actually, there's a name for this coined by Dr. Richie Shoemaker called CIRS, chronic inflammatory response syndrome. And this can create chronic pain. And so mold toxicity or mold in the environment. And you remember yeast, I said microbial imbalance, that's mold inside of you. But this is mold outside of you that you're breathing in, mycotoxins and other mold contaminant, biotoxins that can contribute to chronic inflammation. So if we look at, okay, these are some of the basic triggers, right? So going back in time, we said, number 1, trauma. Number 2, sedentary behavior. Number 3, we said lack of movement, not quite the same thing as sedentary behavior. So those are the physical cues for the manifestation of chronic inflammation and chronic pain. Now, some people actually overtrain, and I didn't mention that earlier. So if you work out too aggressively, if you work out too much, if you don't rest enough, that can contribute to chronic pain as well. And we didn't get into sleep, and we're not going to get into sleep today, but sleep is very important for the regulation of your circadian pattern and your hormones like cortisol, which help also to control inflammation. So sleep is a critical element and very, very important. So we've got those physical behavioral processes, but then we also have what we're exposed to, food or food, the chemicals in food, right? These two really go hand in hand. We've got what food provides in the term of nutrients. So I mentioned protein, I mentioned B vitamins, I mentioned some other chemicals as well, or some other nutrients as well. And then we talked about microbial imbalances, we talked about medicines, and we talked about mold, chronic mold exposure, all being triggers for pain. So if you're struggling with chronic pain and you don't know why and you're trying to figure it out, it's time to get serious. It's time to start weeding out or ruling out these different triggers. And if you don't rule those out, you potentially are very much going to just continue to struggle. And I'd hate to see you do that. So if you have chronic pain, get with your doctor, rule these triggers out. If you know somebody with chronic pain, share this information with them to help them figure it out. Now, I want to dive into some of the, I said if you stay with me to the end, we'll talk about some of my favorite nutrients to use to help support and modulate a healthy inflammatory response. Many of you have chronic pain after years of all of this has been triggered and all of this is happening. And so how do we come back from that? Well, part of the way we come back from that is we look at nutritional support as a big option. And so part of nutritional support is just eating real food, not eating processed, which is very critical. But another part of nutritional support is you can use targeted supplements to help your immune system behave or to support your normal inflammatory response versus an aggressive, hyper-exaggerated inflammatory response. So I'm going to give you a tool that you can use that might be extremely helpful, and it's a combination of two things. Now, if you've listened to me for any length of time, And quercetin is a type of bioflavonoid, and when you combine high doses of quercetin with vitamin C, you get a synergistic effect at regulating and helping to support a normal, healthy inflammatory response. And a lot of people report very good benefit from combining these two supplements simultaneously. So if you're talking about, if you're using Ultra Q, my advice is 6 to 8 capsules per day to start, combining that with the vitamin C 5 grams a day. Like, that's a really, really strong combination to use, again, to normalize or help to support a normal inflammatory response. Then we have another one, another supplement many of you have probably used or heard of, and that's turmeric. It has anti-inflammatory properties. It's probably one of the most well-studied anti-inflammatories in the world, and it can be a very, very effective modulator of the inflammatory response, down-regulating inflammation when it needs to be down-regulated. So turmeric, the issue here is if you're using a supplement, you want to look for something that's standardized to contain 90 to 95% something called curcuminoids. These are the active ingredients in turmeric that have that inflammation component, or that inflammation modulation component. So you're looking at, to be effective though, you're looking at something like that, about 4 grams per day of turmeric. So if you're buying a turmeric supplement over the counter, heightened inflammatory response. This is a very, very common problem in today's society. I was mentioning grains earlier. One of the problems with aggressive consumption of grains is their high omega-6 to omega-3 levels. So grains are supercharged in omega-6 and have very little to no omega-3, and that combination of that food, eating high levels of omega-6, can drive chronic inflammation. So you've got to balance them out with omega-3 fats. It's not the only function of omega-3 fats, but it's one of the big ones. Omega-3 fats also play a role in blood viscosity, so keeping the blood thickness or viscosity nice and thin, as opposed to too thick where it's harder. Your heart has to work harder to pump blood and oxygen. Omega also, there's a particular compound in omega-3 fats called DHA, docosahexaenoic acid, which is important for cognitive function, and its deficit is linked to inflammation in the brain, and it's linked to dementia. So very, very important that you get this DHA from your omega-3 fats, or this is a type of, again, a very healthy brain fat. We know too, I've mentioned this a couple times, but we know that vegetarians, they can get omega-3 fats from things like chia and things like flaxseed, but those types of fat sources do not contain DHA directly, and it's very hard to convert vegetarian sources of omega-3 into DHA. There's some studies that show that people don't do that very well, so that might be something to consider if you're following a vegetarian lifestyle, is to enhance with some supplementation of DHA, especially if you're struggling with chronic inflammation and chronic pain. Another one of my favorites is enzyme therapy. Now, when I say enzymes, I'm referring to proteolytic enzymes. Proteolytic enzymes have been actually quite well studied, and there have been a number of research studies showing how proteolytic enzymes actually help to modulate inflammation. And some research actually shows, and there are a number of supplements that are out on the market that use proteolytic enzyme as a form of kind of self-pain management, where many people want to take a natural option or use a supplement for that. There's a product that I recommend here. If you're going to attempt to use them, the key is you want to make sure you've got a good brand or a good version. The one I recommend is called Magnesium. And if you're looking at quantity, if you're using this particular one, it's 6 to 8 capsules. Now they're really tiny capsules, so they're about the size of a baby aspirin. So 6 to 8 seems like a lot, but these are really tiny and pretty easy to take. The key with proteolytic enzymes, though, if you're going to use them, you need to take them on an empty stomach, because if you're taking them with your food, what's going to happen is they're going to digest your food, and then they're not going to get to your bloodstream. The goal of proteolytic enzymes is we're trying to get them into your bloodstream, because the action of proteolytic enzymes, that inflammatory modulatory reaction of proteolytic enzymes, it needs to happen in your blood. So you can't just put food in and then take the enzyme, because it'll just digest your food and it'll lose its potency and never hit your bloodstream. So these have to be taken on an empty stomach to actually be effective. One of my other favorite ones is magnesium. Now magnesium, we've talked about it in a number of shows, 700 plus different reactions for magnesium, but one of the predominant roles of magnesium is energy production. It helps you to convert the macronutrients, fat and carbohydrate, into energy. Now, energy is basically it's a prerequisite for you to be able to heal and modulate this process. So a lot of people, because of the high levels of sugar in processed food in the diet, become very magnesium depleted, and that magnesium deficiency can also contribute to that chronic inflammatory process. So magnesium, very, very important. One of my favorite to make sure somebody's not low in order to properly regulate inflammation. And so kind of a good starting place. You can go higher, but 600 milligrams a day is a good starting place for magnesium. Some people take magnesium and it makes them tired or makes them lethargic. So, you just have to kind of play it by how it makes you feel. So if it's making you tired or lethargic, it's probably not a good idea for you to be using it. It's actually one of the very few side effects I've ever seen in people that take magnesium. But again, we don't want to take too much of this, especially if you've got a kidney problem, because it can start affecting you in a bad way. But most of you are going to do just fine somewhere around that neighborhood. And then the last one I'm going to add to this list of 7 is B vitamins. Now, I mentioned earlier vitamin B12 and folate, and part of the reason why is that those two play a role. They have kind of a unique role. Vitamin B12 and folate both help to lower a chemical called homocysteine. And homocysteine elevation, so this is something you can ask a doctor to measure, homocysteine levels in the blood. And high levels of homocysteine can cause pain. They can cause inflammation and pain. And B vitamins are the only thing that can lower homocysteine. No drug can do it. So the 3 B vitamins predominantly that lower homocysteine are vitamin B12, vitamin B6, and folate. Now, on that same token, I said earlier that B12 deficiency can cause a different kind of pain. So this would be a physical pain manifesting in the muscle predominantly. But B12 deficiency can also manifest as a neurological pain, so neuropathy, so numbness and tingling, or sharp shooting, stabbing pains, or burning pains in the feet. Like, those are all possibilities with vitamin B12 deficiency. Also possibility with B6 and folate deficiency. These 3 B vitamins can cause neurological pain. So again, if you're experiencing more of a nervous pain or a nervous system pain, then you might consider B vitamins as a strategy or as a tool. Now, my favorite here, and B12 is called methylcobalamin. And my favorite form of vitamin B6 is pyridoxal 5-phosphate, so P5P for short is the way that's sometimes abbreviated. And then folate should be a methylfolate as well. So B12 and, I'm running out of room here, B12 and B6, it's important that they're both methylated for most of you, and then B12 and folate, but it's important for your vitamin B6 if you really want to get the best bioavailable form. It's pyridoxal 5-phosphate. Your body can recognize that and use it much easier than it can some of the other forms of B6 like pyridoxine hydrochloride. So that being said, B vitamin is very important. Now, B12 also produces the myelin sheath. Vitamin B2 also helps in that process of forming the myelin sheath. And we also have vitamin B2 that's important in the energetic production. So much like magnesium helps you generate energy from carbs and fats, so too does vitamin B2, so too does vitamin B3. So too does vitamin B1. So those are all important nutrients as it relates to helping control pain through their ability to help your body generate the energy that it needs to heal and repair. So that's what I've got for you tonight. I'm going to dive into your questions. So if you've got questions and you want me to answer them, go ahead and start typing those in now. Many of you have already started to do that, so let's kind of go through what we have here. Never heard of sedentary inflammation. Well, you have now, Sebastian. Welcome to the show, and I'm glad you learned something tonight. Let's see. What's the best way to combat cervical osteoarthritis pain? I've got both Graves' disease and Hashimoto's, which also adds to the pain. So the best way, Vicky, is to look at, I don't know if you've had x-rays and that's how they were diagnosed. A lot of times people are told they have arthritis, like osteoarthritis, but never really had anybody take an x-ray. That's the real way to diagnose osteoarthritis is to take an x-ray and actually see the arthritis, on the actual films. But if you've truly got that, some of the best way to combat osteoarthritic pain in the neck is to find a good chiropractor and get manipulation. Manipulative therapy can be very, very effective to combat osteoarthritic pain. Other things you can do from a supplement perspective that might be helpful, aside from what I've already discussed, MSM and glucosamine. These can be effective for osteoarthritic pains, and so in that regard, I would recommend something like Ultra Joint, which has both of these in it. Ultra Joint is one of my formulations that has a combination of the two. Okay. Let's see. Karen says, I have the Ultra Q and vitamin C. How long until it takes effect, and how long should I take that much? Well, you can take that much, relatively indefinitely as long as you're not having side effects of loose bowels or diarrhea from the vitamin C. But as far as the how long to take effect, it can take a few weeks to really start setting in. So, and in some people, the effect is relatively quick. It's within a few days, even as quick as a few hours. Let's see here. Magnesium makes my husband and I sleepy, so we take it before bed. Is that wrong? No. And that might be one of the scenarios where, what I was just talking about, where magnesium, if it's making you too sleepy or if it's making you lethargic, might not be a good idea to take it at all, unless you find that you just sleep better and wake up more rested. Okay, my husband's blood test came back high homocysteine. Could it be his pancreas? He also had higher levels of insulin resistance. No, high levels of homocysteine, generally speaking, are B vitamin deficiency directly, Deandra. So if his levels of homocysteine came back, it would be B12, B6, and folate, and also B2. Those 4 B vitamins help to modulate homocysteine. Also, the amino acid methionine can help with that, particularly SAMe, S-adenosyl methionine, which is an amino acid substrate that helps to metabolize homocysteine and get rid of it. So high levels of homocysteine beyond that. Some people have kidney disorder or kidney disease, and that's why their homocysteine is high. That's another reason why homocysteine can be elevated, but generally speaking, it's a B vitamin deficiency issue. Tanya, thank you, Dr. Osborne, for your YouTube hours. Incredibly informative and very much appreciated. Thank you, Tanya. Glad you're finding them so helpful. What makes B2 shut down UT? You got to give me more information, Ellen. I don't know what you mean by UT. Urinary tract, B2 doesn't shut down the urinary tract, but I don't even know if that's what you mean, if that's what you're referring to. So B2 generally is very, very safe to take. The biggest thing it'll do is turn your urine yellow, because riboflavin, which is what vitamin B2 is a very yellow pigment. So if you're taking vitamin B2 and you're peeing out a lot of yellow, generally speaking, that's just because you've absorbed it. You're absorbing it. If you're not seeing yellow come out in your urine and you're taking vitamin B2, then you're either probably not taking B2 and the person who manufactured that supplement's a liar, or you have a problem with absorption and it's not being very well absorbed. So let's see here. I have an addiction to cake and ice cream. Get help. if sugar's your addiction. Now, I mean, let's talk about that for a minute, because maybe a lot of you struggle really with sugar addiction. It's not really, it's truly not a laughing matter. Sugar addiction, beyond the fact that it can be a chemical addiction that can keep you, keep you having to use it, it's a social addiction. People hang around with other people who use sugar, and if you hang out with other people who don't love themselves enough to really take their diet seriously or their health seriously, then you're going to inject yourself into a never-ending battle, because if you put it in front of it, if this is like alcohol, if you put alcohol in front of somebody who's an alcoholic and addicted to it, they're going to have a heck of a time staying clean. So sugar's no different. You've got to keep it away from you, and if that means not going out, not eating out, not being around other people who are mass consuming sugar on a regular basis, then you got to make the right decision for yourself. And sometimes that's a tough decision to make. Like, I get it. You don't just want to kiss off all your friends and say go away because you like sugar, but you've got to be sound. You've got to know yourself, and if you know that you're going to be tempted, then you have to mitigate who you hang out with. There's a number of ways to say this, but you are the summation of the 5 people you hang out with most. So if you hang out with a bunch of unhealthy people all the time, it's going to be really hard for you to overcome your illness if you're surrounding yourself by people who are chronically sick too and struggle with sugar addiction. So take that part seriously. Hi, Doc. Can inflammation cause low-grade fever? Yes, it can. Chronic inflammation can cause low-grade fever that comes and goes intermittently. So that's a very, very common, very common side effect of chronic inflammation. Let's see here. Hi from Missouri. I've been watching your videos and reading No Grain, No Pain, trying to get myself healthy, eating no grains, thinking I may have to remove dairy. Also, I've spent over 2 years going to doctors and they find nothing wrong with me, but I'm not healthy, trying to find a good functional medicine doctor. Yeah, call my office. If you're struggling to find somebody, call my office. We'll help you out. Let's see here. Would Magnesium help with headaches and back pain? How much could you take? So it's possible that it could. Again, it's one of those things that what I'm trying to do is give you ideas of what you maybe haven't tried. Ultimately, what I'd like to see you do before just popping a bunch of pills and supplements is really working with somebody, kind of a one-on-one scenario where you're isolating and identifying what you actually need. But can Magnesium help with headaches and back pain? Yeah, I've seen it help people that have suffered with chronic headaches and back pain. So as far as the quantities, again, I gave you a 6 to 8 kind of capsule range there, and that's I stand by that. Ever dealt with anyone who had burning mouth syndrome? Yeah, all the time, Tracy. Burning mouth oftentimes is a sign of mold toxicity, and you just haven't found it yet. It can also be heavy metal toxicity. It can also be inability to detoxify. There are a number of reasons why that can happen. So to answer your question, yes. Cindy says, I can't take vitamin C supplements without my face swelling up. Why? Love that question, because, Cindy, you're probably taking vitamin C supplements that are corn-derived. And corn derivative, grain derivative, right, isn't a good way to get your vitamin C. This is why I recommend, this is why I didn't write down vitamin C here. I wrote down Detox C, because that is the problem. I don't recommend any other brand of vitamin C because we take great care, great pains to make sure that ours is absolutely grain-free, filler-free, and a pure ascorbate with buffered minerals so that you minimize any type of side effect that might happen. Let's see. Suk says, I have systemic scleroderma and lung fibrosis. How do I tackle fibrosis, spreading and treating? Please help. Look, if you've got scleroderma, there's just no doubt about it. Quit going on your own. If you're on your own trying to work it out, and my experience in working with people with scleroderma is that when they go it alone, they generally are not successful, because you can't get accurate enough or objective enough outside of your own body. You can't get objective enough to really discern what needs to happen, because you're micromanaging your day-to-day symptoms and you're making too many adjustments, too frequent adjustments. You've really got to have a great, in my opinion, a functional expert really working with you to really navigate the disease of that magnitude. Let's see, Dory wants to know why her glands are swollen even when I don't feel sick. Because you've got a chronic immune stimulus. When you have chronic swelling of your lymphatic glands, whether it's in your mouth, under your neck, in your neck, under your armpits, that's a sign that your body is chronically attacking something, right? Whether it's food, whether it's chemical exposure, whether it's environmental mold, whether it's some type of viral infection or some other type of infection or microbial imbalance. All those things should be ruled out. You don't feel sick because your immune system right now is able to keep up with it. But over time, as as that continues to happen, your immune system, your immune system could potentially fatigue, and then you're going to be in a pickle. June wants to know, how would a person determine how much protein is needed? Generally speaking, depends on how well your kidneys are functioning. If your kidneys are damaged, it's a different answer than this. So we're going to just go with a non-kidney damaged answer. Generally speaking, if you're not exercising, if you're happy with your current body weight and there's no aggressive physical activity, then about 0.8 grams of protein per kilogram of body weight. So I'll write that formula for you. So it's 0.8 grams per kilogram of body weight in pounds, or body weight. So to get your kilograms of your body weight, you divide your weight. So if you're pounds, divide that by 2.2, and that equals kilograms of body weight. And you can take that number, multiply it by 0.8, and now you have how much protein you need to sustain your current body weight and to sustain your current average protein need. Now, if you're aggressively working out or exercising, that formula is not the best formula for you. You're going to actually probably become protein malnourished, have a lot of muscle soreness, and not recover very well, and develop tendonitis and other problems as a result of exercise. Not at that level. So for exercise, really it needs to be 1.2 grams per kilogram or more, especially if you're exercising aggressively. Let's see here. Vicky, let's see, no. Sybil, can chronic pain lead to weight loss? I have 2 sources of chronic pain, chronic appendicitis from parasites and 4 zirconia implant post causing glossitis with a naturopath against chronic Lyme. So, yeah, it can. Chronic inflammation can lead to weight loss. The problem with chronic inflammation is it causes your body to produce cortisol. Cortisol is the hormone. It's like your internal fire truck. So when you're chronically inflamed, your body tries to produce more cortisol to put that fire out. Cortisol is like it is a corticosteroid. You know, when a doctor treats you for pain, a lot of times they use steroids to do that. Well, you make your own steroids. On your kidneys are your adrenal glands, and those produce cortisol. So if you're chronically inflamed, your cortisol levels naturally will go up. The problem with that happening chronically is that if your cortisol levels are elevated for long periods of time, cortisol degrades your muscle tissue. So it eats into muscle. It causes muscle atrophy and muscle loss. It's one of the side effects of taking steroids long term is it causes muscle and bone loss. And so subsequently when you lose muscle mass, you lose weight, and you can become what oftentimes referred to as TOFI, thin on the outside, fat on the inside, or skinny fat, which again is basically as your muscle degrades and wastes away, your body metabolically slows down and you store and you pack on more fat. And even if you're not externally obese, you pack on more fat abdominally around your core, and that's some of the most dangerous inflammatory fat we could pack on. Let's see, Tanya, if you're taking vitamins and your urine is coming out the color of high vis green, I don't know what high vis is, Tanya. Maybe elaborate, but I'm going to assume you mean high green or like a green color. Is that a worry? You should not be urinating a green color. Yeah, that's a concern. I would say that I would question what's in your vitamins if you're peeing green. That might not be the best thing. Let's see here. On a true gluten-free, Sybil says, on a true gluten-free diet, no dairy, no eggs, no gluten, no corn, eat grass-fed beef. Where I don't see the question there. So, Julie says, all the supplements are overwhelming. Should one start with everything or start with the first one suggested and slowly add in? Or do we have to address yeast first? Julie, it depends. It depends on what's causing the inflammation. So again, the premise of tonight's show wasn't to throw a lot of supplements at you and say, hey, go buy a bunch of supplements and hope something sticks. The premise was really to educate you on where the sources of chronic inflammation come from. Again, lack of behavior or lack of activity, sedentary lifestyle, trauma. We've also got food as a trigger. We've got chemicals as a trigger. We've got microbial imbalance as a trigger. We've got nutritional deficit and calorie malnutrition as triggers. We got mold and mycotoxins as triggers. We got environmental toxicants as triggers. Find those. That's where your truest answer is going to be. If you're trying to control your pain while you're trying to look for those triggers, then I would start here. I would start with number 1 and 2. That would be like, if we're going to pull out a big gun and say, let's start with that. Again, but don't start with this indefinitely. Like, I would never recommend this process right here to somebody without looking for triggers. Because if you recommend, again, if you're feeling better doing this, but you still have, 4 or 5 of those triggers that are firing off inflammation in your body, ultimately what's going to happen is you're just masking it with these supplements, and you don't want to do that either. The supplements are designed to support you, but they're not designed to mask the underlying origin of the problem. And so you always want to go after the origin first. I mean, that's why my clinic, that's why we call it Origins Healthcare, because we're looking for the origin of where the problem is coming from, and that is the most important thing that you can do. Let's see, Ali wants to know if we have no grain, no pain in Arabic. I wish we did. We're working on it. Hang in there, buddy. We're working on it. I was using my body grinder with a big wire wheel and accidentally removed at least 1 layer of skin in lower leg, an area of about 1 1/4 inches by 1 1/4 inches. Recommended for getting that to heal faster. Yeah, I would use vitamin C, and I would use branched chain amino acids, BCAAs. We have a formulation or a blend of something called Ultra Amino that works really well. You can also wrap it to prevent any kind of, like if you want to try, if it's really exposed, depending on how much of the skin is actually removed, if it's really exposed and you're trying to prevent infection, some people will wrap it in a gauze. Some people pack wounds like that with honey. Honey is very antimicrobial and can help prevent infection if you're trying to do something naturally, but be careful in that regard. I'd really visit a doc and make sure that there is no infection and that damaged area doesn't need any kind of debridement or more aggressive type of treatment, because you don't want an infection to get in you and then it festers and it goes septic and then you're in big trouble. Let's see. Do you think Cheerios are considered gluten even though it says gluten-free? Linda, I need you to go buy No Grain, No Pain tonight. Like, do me a favor right now and head over to Amazon and pick your copy of No Grain, No Pain up. And I don't say that as a jest. I say that in all honesty and all seriousness. If you're asking me if Cheerios are gluten-free, then I need you to get better educated, and that's what's going to help you. No, Cheerios are not gluten-free. Yes, they're made out of oats. Yes, the food labeling laws consider oats to be gluten-free, but oats have a form of gluten in them called avenin, and for many people that are struggling with gluten issues, avenin is a major trigger. The other issue with any Cheerios product, I don't know if you saw the recall, it's about 1.5 years ago, but Cheerios, you can't trust them because look, the reality is they did a major recall because even their oats were contaminated with wheat. And so a lot of these big corporate company conglomerates, look, you can trust them if you want to, but I don't trust them. I don't trust them any further than I could throw their bank accounts. I mean, these super, not that being super wealthy is a crime, but these super wealthy companies generally develop their wealth as a result of preying on the ignorance of others. And the cereal market is one of those industries where they pack food full of carbs and sugar and tell you to douse it in genetically modified loaded dairy and tell you that that's somehow a healthy, balanced meal. Like that in and of itself, that whole premise is archaic and in my opinion, it's damning and damaging. Let's see here. Oxalate toxicity. Love it, Tess. Yes, you're right. Oxalate toxicity can also create or contribute to chronic pain. Oxalate can form crystals and store in different tissues and create a lot of chronic inflammation in joints as well. So oxalate's another one if you're struggling that you might look into a low oxalate diet. And although that's a more rare manifestation in my experience, and that generally it has to do with other foods first. So don't put yourself on a low oxalate diet without trying those other things first is my point. Let's see, Kelly, how long does it take for inflammation to go away? I did an elimination to keto diet for over 6 months before I fell off the wagon and still have chronic hives, welts, urticaria, and now rash. Kelly, you got to get it figured out. In an elimination diet, it's not going to cut it. They very rarely do. The problem with elimination diets is that they don't eliminate what's called a delayed hypersensitivity response. Understand that type of a response has a window of inflammation of about 3 weeks. So if you're doing an elimination diet and you're trying to take away things and then add things back in, unless you're doing each food for 3-week periods, you're not really going to figure that out, very, very likely figure that out. You've got to get properly tested, Kelly. Again, the best thing I could tell you to do is call my office and get more information about how to get properly tested, because if you're breaking out like that, you've got something that you're still getting exposure to, and whether it's food or whether it's environmental, something's still creating that problem. Okay, let's see here. And how to get homocysteine down to optimal level. Mine rarely goes below 10. Taking methylated B12 and folate, red blood cell, always 15 to 1700, serum B12, fasting 1500 without supplements for days before, MMA and MBV always mid-range. What else to do? You might check your kidney function in. Again, there are some people that have problems there. And then methionine or S-adenosyl methionine or SAMe might also be helpful to lower your homocysteine as well. So I would give those a try. Let's see, Suzanne. So enlarged lymph nodes in the groin that I have had for over 10 years may indicate a chronic inflammation or infection. Yes, and they probably do, Suzanne. It's not a maybe even really there. That's in my experience. It's generally the case. June says, I've had a disc injury for 10 years and have chronic pain. What nutrients are needed? That's a pretty broad question, June. I mean, if you really want specific advice, I'd say call my office or find a really good doc. Because if you've got a chronic disc injury, depending, I mean, is it impinging on the nerve root? Is it creating a neuropathy? Is it an extensive enough, or is somebody telling you that you have a disc injury, but it's really something else? Have you tried traction therapy? Have you tried decompression therapy? Have you tried something like Graston technique or chiropractic care? I mean, there are a lot of different potential options or possibilities for somebody with a chronic disc injury, and I'm assuming you mean either in your neck or your back. And then nutrients. As far as nutrients, it's unique to the person. So I've given you kind of a list of some things that can be done, but it's very much the nutrients that people need are very, very unique to the person's need. Love this. Corazon, I don't know if I said your name right, but I tried. And so been on your diet for 30 days, for 4 days in inflammation, or been on your 30-day diet for 4 days. So you're 4 days into the no grain, no pain 30-day diet for eliminating chronic pain and inflammation. And your inflammation's already gone down, yay. But the last 2 days you've been in pain after everything I eat, even though I know it's grain-free approved by you. So again, this might be where you have an issue with microbial imbalance. And that is oftentimes the case when the diet is not controlling the pain consistently. Now, first of all, Corazon, you're only 4 days in. Get through the 30 days. You might find that that's just like kind of a medium flare. Sometimes what happens is we take 2 steps forward and a step backward, 2 steps forward and a step backward. Like that's a very, very normal process. And so that may be part of what you're going through because you're only 4 days in. But again, you might have some key nutrient deficiencies. You might have some other foods that you're eating that are not being eliminated by the generic protocol in the book. Nushka says, Dr. Osborne, what does this mean? I don't know what you mean. What does what mean? Oh, HLA-DQ8 positive, HLA-DQ2 negative. So it doesn't mean a whole lot because what I don't know, it means something. You have an HLA-DQ8 gene allele, but do you have 2, 3, or 4 of them, or do you have 1 of them? Because again, a DQ8 positive, that's referring to a genetic allele. Now, when we're talking about gluten-sensitive genetics, we're looking at HLA-DQ genotypes. This is going to get very, very techie for a lot of you. But HLA-DQ genotypes, there are a lot of different varieties. And having a DQ8, what that basically means, it depends, is because you can have 1 8, you can have 2 8s, you can have 3 8s, or you can have 4 8s. So I don't know what it means because I don't have enough information to really be able to give you an adequate kind of explanation of that. As far as HLA-DQ2 negative, it means you don't have a DQ2, which 99.8 or 99.7% of all celiacs have HLA-DQ2 genotype patterns. But you could have, Nushka, HLA-DQ1 or HLA-DQ3, and those are both genetic patterns for non-celiac gluten sensitivity. So you really don't know anything. If you truly want to have the right HLA-DQ testing where you can get the data that you need to determine whether or not going gluten-free is the right move for you, you've got to get properly genetic tested. I don't know if Mel can throw up our link to gluten sensitivity genetic testing, but I'll send you a link. I'll put it in the feed for the proper type of testing that gives you all the data points for both gluten sensitivity from a celiac perspective, but also from a non-celiac perspective, because that's what you really need in order to be able to ascertain that. Okay, the best way to heal skin lesions from a celiac condition is to go gluten-free. That's a simple answer, Virlig. Is there any topical cream that are effective in treating these? I mean, you can use a lot of topical things that can be effective, but if you're talking about skin lesions from celiac, you're probably talking about dermatitis herpetiformis, which is like a herpes. It's like a herpetic blister rash, and so that type of rash, you can accelerate. I've seen cases where we could accelerate and help, but not applying things topically, more by applying things internally. And vitamin C is one of the best. The 5-gram vitamin C can be a very, very effective method to help with that. Let's see, but it could also, if it's not dermatitis herpetiformis, it could be a different type, like an eczematic rash, or it could be another type of rash. It's hard to say. I'm not seeing your rash, and certainly without seeing you in a face-to-face scenario, it'd be hard for me to really say or comment really super intelligently. Julie says, I can't find Ultra Q on your website. It's because we just changed the name, Julie. Sorry. It's called InflammaShield. So if you type in InflammaShield, and maybe we can put that link up for you in the feed, but we just changed the name. So InflammaShield, which is what it used to be, is now called Ultra Q. So if you're looking for Ultra Q, look up InflammaShield. I think my web people are on that this week. They're trying to get that changed. Let's see. How do you decrease the craving for grains? That's a great question, June. If you are really struggling with that addictive nature of what grains can contribute to, one of the best ways to control the cravings is to buckle down for the first 2 weeks and go through the withdrawal. Some people go through the withdrawal, what's called a Herxheimer withdrawal, or what's basically almost like a drug addiction withdrawal, because there's certain proteins found in grain that mimic morphine. So you can literally go through a withdrawal phase where you have the fevers, the chills, the shakes, the irritability, the headaches, the muscle aches, just the general malaise. Now, one supplement that has been shown to help people with addiction properties is niacin and also vitamin C, and combining the two together. So 5 grams of vitamin C combined with niacin, and there are different doses for niacin, but 250 milligrams is generally a decent way to begin that. Now remember, if you do take niacin, if you decide to take niacin, it causes something notorious called a niacin flush, which causes your skin to turn really red and almost looks like you're breaking out in hives. It's not an allergic reaction, but it's a niacin flush. And so some people get scared off of niacin when they have that flush, but those are probably some of the best ways I could say dealing with the cravings if you truly have the addictive component with grain, with some of those morphine-like proteins found in grain. Okay, man, I think we went over tonight. So again, a couple different things before we wrap it up. If you like this video, give me the love, show me the love, hit the like button, really hit the love button, or hit the thumbs up button and share it with somebody that you know who can use this help, who needs help. Additionally, if you don't already have a copy of No Great, No Pain, head over to Amazon or Barnes & Noble or any other major book outlet and pick up your copy. Look, the information in that book will give you the premise to show up every Monday and really understand better what I'm talking about and take your health to a whole nother level. The other thing I'd like you to do is come over and visit us at glutenfreesociety.org, where you can subscribe to our free newsletter. We send out a couple of times a week giving you wonderful information about the gluten-free and the grain-free lifestyle, but we're also going to send you and hook you up with a gluten-free survival guide. So when you sign up for our newsletter, that's the first thing you get from us, is a survival guide. It kind of helps you navigate what you need to start learning in order to really get your health in a great direction. As always, thanks so much for tuning in with me on Monday nights and sharing your evening with me. I'll see you next week, 6 p.m. Central Standard Time. Have a great week, and I'm wishing you excellent health. Take care. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time, for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.